My name is Karen Munyon. I am the Director of Radiation Oncology Satellites here at Vanderbilt University Medical Center. My role is to direct 3 of our off-site radiation oncology facilities as well as to support the main campus location. I got involved in radiation oncology during my college years. I became interested and knew I wanted to do something in the medical field but did not really know what I wanted to do and lucked into this field. The minute I saw it, I knew it was something I wanted to be a part of. It had the technicality of computers, but also the human element of taking care of patients. Each patient's treatment is unique and focused to them, so even though you may be treating 5 or 6 patients in a row that are the same diagnosis, each and every patient's treatment was different, and I really liked the unique individuality of that. During my role I have to start over.
You're fine. No, you're fine.
Okay. During the early years of my career, I was a radiation therapist, so I spent many hours treating patients. It really is the absolute love of my career. I miss that on a daily basis since I'm now more in an administrative role, although it does allow me to ensure that our patients are being treated properly and correctly, as well as very safely. And it also gives me, I think, a rapport with our staff because I do have the knowledge and skill that it takes to treat patients, so I understand the problems and some of the issues that are encountered treating patients on a daily basis. I think some of the most unique things that I remember about treating head and neck patients have to do with the type of patient that you have. Typically, those diagnoses that are in the head and neck region are a little bit more advanced just because of sheer nature of location. You have a lot of small parts and close anatomy in that area, and so when you have cancers in that region, it can affect them greatly. Everything from changes in taste, inability to swallow, inability to keep weight on, all can affect the radiation that we give our patients. And so it's very important that we closely monitor our patients and also ensure that they maintain healthy weight and be able to get through their treatment as painlessly as possible, although it's probably one of the roughest treatments that our patients go through because of the fact that it does affect the swallowing, the mouth, saliva, all of those things that we depend on as regular human beings on a day-to-day basis. Being a radiation therapist gave me a unique aspect to treat head and neck cancer patients, and they're all different. Most of our patients have very complex issues, ranging anywhere from keeping on weight, swallowing, breathing issues. We have skin irritation in the neck. It's very hard for them to maintain a stable diet. It's very important for our patients that they not lose any weight during this process. It's not the good time to go on a diet. They need to maintain a healthy weight. It's important for the body function because it allows them to fight the cancer cells as well as the normal cells that we're killing with radiation. The body has to get rid of those in some form. And if it's not healthy every place else other than the region that we're treating, that makes it very difficult for our patients. Many patients have problems with swallowing. They feel like there's a lump in their throat. They have to stay away from foods that they often love. Acidic, spicy foods cannot be tolerated because of the amount of radiation that they're getting. Things such as keeping normal dental care becomes extremely important because we don't have saliva like we did before with the radiation. It actually damages some of the glands, and we try to spare those glands as much as we can, although there is no 100% way to do that. So often that effect changes the way that we digest our food. It also can cause more dental caries and cavities and things of that nature, so dental care becomes a very important part as well. Patients often will go through a period in the beginning of radiation where it may not seem like it's having much of an effect, but it is cumulative. So what happens is they get to a certain portion of their treatment and then it feels like all of a sudden everything hits at once. So we have to encourage our patients to maintain that healthy weight, to stay on their plateau, to beef up their diet in other ways, maybe adding Ensure to a milkshake instead of milk to get extra calories, eating several small meals a day instead of 2 or 3 big meals, making sure they get enough rest. Rest is extremely important, and fatigue is a huge side effect. So listening to the body, taking that nap in the afternoon where you normally would not have, greatly benefits the patients as well. Oftentimes, patients will encounter a phase where they may feel depressed because they're not able to do the things that they normally do. Either whether that be enjoying a meal with their family, going out and being able to be outside, because they do have to protect the skin in that area because it does have a radiation sensitivity to it and acts as if a sunburn has happened in that area. Also, making sure that they get enough rest. They just don't feel like that person that they were when they started. The side effects that come on with radiation oftentimes don't peak until after the radiation has completed, and usually it's a couple weeks after the last treatment. So what happens is those patients are climbing up a plateau, and they don't plateau until after the patient's radiation has completed. Then they finally get on that downhill slope and begin to heal from all of the effects and the things that we've done to them to help them get through this process of treating the cancer. Unfortunately, that can be depressing for a patient because they just feel like once the radiation is done, then they should be able to pick up and leave off where they started, but that doesn't always happen. So we encourage our patients to be patient, to get proper rest, nutrition, make sure they're hydrated, and make sure that they listen to their bodies. The one thing that I've noticed during my treatments with cancer patients is that those patients that have a more positive attitude coming into treatment generally seem to do better. No real statistical information on that, but it's just something I've noticed over my 20-year career. I know that those patients that seem to have a negative look on their cancer just seem to not flourish during the treatment as much as others. I know that what I have seen, sometimes it's difficult for patients to let go of daily life because they have spent their lives taking care of someone else. This is their time to focus on themselves. We often tell our patients, don't worry about something. It's hard not to worry, but your focus needs to be on you. It's your time to focus on getting your cancer care and getting through your treatments, all of those things, and focusing on you so you can help others again. We want our patients to be cured and to come back and say hi and tell us how they're doing. We want to know they've done well and that we've done a good job as well too. So the best advice I have for patients is listen to your body and rest. Make sure that you're getting everything that you need, and don't worry about everything else. The house will still be dirty when you come back at the end of your treatment. It will still be there, I promise. There's no rush to do those things. Just focus on you.